Hello, this is Jenny Hosbach, the Director of Training and Education for Practice Transformation Institute, and Ruth Clark and I welcome you to Session 0, the Community Health Worker Program Explained. So we're going to go over all the things that you need to know about the program as you decide whether or not you want to engage with us in this community health worker education. So when we welcome folks, we ask them to sign in using the link in the chat box and to plan on attending the entire session. PTI uses active learning strategies which encourage learner participation in addition to question and answer opportunities. So what do we mean by that? Anytime we present a program, we focus on the learner, and we want to make sure that we use teaching learning strategies that engage the learner so that when this program is over, you don't have questions. We want you to have clarity, and so we want you to communicate with us as you hear content. If you have any questions, we want to make sure we are clear and understandable, and the information we share with you is of use and benefit to you. So please ask questions anytime during our presentations and seek clarification whenever you have a concern. Also, we have found in teaching for many decades that there is so much wisdom in our learner population that we'd like you to share that by giving feedback to not only your fellow participants, but to us, because you have experiences that can help provide examples of practices that you have engaged in. So we use virtual etiquette because this is a virtual program. So we expect cameras and microphones to be on if able. And you can use your raise hand function, or you can use the electronic raise hand function on a little blue hand. You can use the chat function. We have someone always monitoring the chat function. And when you have a question, just unmute yourself and ask. It's important that you have your questions answered. We want to make sure that our backgrounds and surroundings are clear and that you position yourself in the light so that you're not in the dark background. So who are we? Practice Transformation Institute was founded in 2007, based in Southeast Michigan. PTI is a 501c3 nonprofit organization that provides continuing medical education, or CME, and international accreditors for continuing education or training, which is IACET. These accredited learning programs have been earned by PTI, and we focus on implementing the multiple principles of the patient-centered medical home and other primary care transformative initiatives, such as teaching the community health worker program. Our mission at Practice Transformation Institute is to use proven learning methods and business education strategies. We empower physicians, advanced practice providers, and their medical office teams, and the greater healthcare community through training programs that are customized to fit each group's needs. PTI exists to inspire and assist individuals and organizations to improve how healthcare is delivered in their communities, in the state of Michigan, and across the country. I mentioned IACET. What is IACET? IACET is an organization that we sought accreditation from many years ago. PTI is accredited by the International Accreditors for Continuing Education and Training, and we offer IACET CEUs for learning events that comply with the ANSI or IACET Continuing Education and Training standards. It's important to recall or remember IACET is recognized internationally as a standard development organization and accrediting body that promotes quality of continuing education and training. I would be remiss to not tell you, this was a rigorous application that we did, I don't know, I think about 15 years ago for the first time, and we were approved, which makes us a bit unique from other training and learning and training organizations. The Michigan Department of Health and Human Services has approved our CHW program. PTI's Community Health Worker Program is approved as a provider of community health worker curriculum by the Michigan Department of Health and Human Services. PTI's CHW program complies with the requirements of the CHW Core Consensus Project, and you will hear more about that later. It's called the C3 Project. So we ask people, what are the definitions of a community health worker? And they're pretty varied, but let me give you some that come from the national scene. The National Institute of Health developed their definition 10 years ago, and they still hold by it. Community health workers are lay members of the community who work either for pay or as volunteers in association with the local healthcare system in both urban and rural environments. CHWs usually share ethnicity, language, socioeconomic status, and life experiences with the community members that they serve. Another definition, again, 10 years old, but they still use it, is from the American Public Health Association, and they define a CHW as a person who is a frontline public health worker who is a trusted member of and or has unusually close understanding of the community served. They serve as a liaison or a link or an intermediary between health, social services, and the community to facilitate access to services and improve the quality and cultural competence of service delivery. Now, taking many definitions into account, our program's definition or description is that a CHW is a member of the community who serves as an advocate and liaison to connect individuals and their families to healthcare and social services. They have a strong connection to the communities they serve. CHWs may share the same ethnicity, race, language, socioeconomic characteristics, cultural practices, spiritual beliefs, and life experiences as their community. CHWs work in urban and rural environments and with low-income, minority, immigrant, and underserved communities. They have diverse job descriptions as well as job titles, depending on the organization in which they work. Now, before we move on to talking about the roles and responsibilities, I want you to take a look at this definition because you can see the significance of what a CHW can do. A CHW makes an amazing difference in the population they serve and in the individuals that they work with. Know that you are engaging in a role that is critically important to our healthcare system. So a little bit of history. The first community health workers in Michigan were trained in the 1960s to provide services to their communities. Around this time, the federal government began providing funding for community-based programs that use CHWs to reach underserved communities. Community health workers in Michigan and across the country began having an impact on the national level when in 1978, CHWs formed the new professionals special primary interest group in the American Public Health Association. This group was renamed the Community Health Worker Section in 2001. From its inception in 1978, this group promotes the community's voice within the healthcare system. In 1983, MHP Salute was formed to address the needs of the migrant farm worker population in Michigan using the community health worker model. So all of that being said, what are the roles and the responsibilities of a community health worker? And why is their role increasing? There has been significant recognition of social determinants of health and behavioral health needs in the population we're serving. And we know that social determinants of health and behavioral health needs impact overall health. So we engage CHWs in screening for social determinants of health and behavioral health screening. They focus on the individual and the community's health. Why is it increasing? Because the need for increased health access exists within our communities. There's growing diversity in the USA's population, and unfortunately, a growing prevalence of chronic diseases. We also know that there is an advanced acuity of patients with chronic conditions. And what does that mean? The severity of their illness is increasing. We also know that our population is aging, and we also know that our healthcare system is getting more and more complex. CHW's role is to have a commitment to work with populations to reduce health inequities and to work to deal with the cost pressures that exist in the healthcare system. We also know there is a shortage of clinical personnel limiting time with patients, but a CHW has an opportunity to spend significantly more time with patients and to hear their story and to get more background about them. So we know that adding a CHW to the care team is increasingly valued. If you look at this circle, you will see a lot of things. Now, we did not create the circle because if PTI created the circle, it would have spelled positive correctly, but we didn't create it. But what are the CHW qualities? Well, the first one is interpersonal skills, kind of like warmth, such as empathy, the ability to listen and to respond to people and communities with both compassion and kindness. Trustworthiness, being honest, allowing others to confide in you, maintaining confidentiality, and upholding professional ethics. Many years ago, an author by the name of Stephen Covey wrote that at the personal level, you must be trustworthy if at the interpersonal level, you want to be trusted. At the managerial level, you want to be empowered, and at the organizational level, you want to be in alignment. And why do I bring that up? You want your people that you are serving to trust you, but you first have to be trustworthy. The next one is open-mindedness, the willingness to embrace others' differences, including their flaws, and to be non-judgmental in our interactions with them. None of us in healthcare are here to judge. I am a nurse, and Ruth is a nurse, and between the two of us, we have practiced over 100 years. And I can tell you, not once did we ever judge a person because that's not our job, nor is it yours. The next is objectivity, striving to work and view clients and their circumstances without personal bias or personal prejudices. We need to be very objective when we work with patients, and we cannot make assumptions that we know what their journey is like. We need another trait of sensitivity, to be aware of and truly respect the experience, the culture, the feelings, and the opinions of others. And how do we do that? By listening to their story. Competence, developing the knowledge and the skills required to provide quality services to all clients and all communities that you work with. We have a commitment to social justice, the commitment in the heart to fight injustice and to advocate for social changes that promote the health and the well-being of clients and communities. Next is good psychological health. Have the mental and emotional capacity to perform your work professionally without doing harm to clients or to colleagues or to yourself. And lastly, self-awareness and understanding, being willing and able to reflect upon and analyze your past, your own experiences, your stories, your biases, your prejudices, to ensure that they don't negatively affect your interactions with clients and colleagues. And it has been very well known that most of us have unconscious biases that we're not even aware of, and they tend to pop out when working with patients and communities. So we have these qualities that exist within the CHW. You can take a look at all these words and ask yourself, which ones pop out to you? Which ones fit? Why you want to engage in the CHW role, and what qualities you have that indicate you're ready and willing and able to do so. So what are some of the proactive roles of a CHW? A CHW builds on an individual's health knowledge and self-sufficiency through activities such as conducting patient or client outreach, follow-up, navigation through this complex system of ours. Another role is to coordinate care between individuals, healthcare providers, and community organizations. Supporting behavioral health by coaching and using motivational interviewing techniques, which you will learn about in this program. Another role is providing social support, including informal coaching, counseling, and advocacy. Promoting understanding and self-management of chronic conditions. Always remember, you could be an expert in a disease, but the patients are an expert in the illness that they deal with. And lastly, performing health screenings and disease prevention activities so that we can improve health outcomes and reduce disparities. CHWs build on an individual's health knowledge and self-sufficiency through things such as cultural mediation among individuals, communities, and health and social service systems. System navigation. We've already talked about the increasing complexity of our healthcare world. Implementing individual and environmental assessments and advocating for individuals. Those are very important proactive roles of a CHW with individuals, but we also have CHW roles with communities. CHWs build on communities' health knowledge by supporting and organizing community outreach activities, finding out what the need is in the community that you're serving, and do an outreach activity. Providing culturally appropriate health education and information. Building trust within the community through access to culturally competent services. Identifying culturally and linguistically appropriate healthcare providers and community liaisons. Another is working with state and local social services organizations to navigate the healthcare system and connect community resources. It's critically important that we in healthcare find out and use appropriate community resources to help improve the care that we provide to our clients or patients or communities. Another proactive role of a CHW is working as a link between healthcare providers and the community, and conducting community assessments and advocating for communities. When we look at all the different roles of a CHW, we should look at all the different titles. If you look at this particular slide, you see things like camp health aide, case management aide, community care coordinator, community health advisor, community health navigator, community health representatives, community liaison, organizer, community support worker, family service worker, human service worker, lay health worker, life skills counselor, outreach educator, peer health promoter, peer health educator, peer navigator, a promotora, or a social work assistant. Now you ask, what is a promotora? That's a lay Hispanic or Latino community member who receives specialized training to provide basic health education in the community without being a professional healthcare worker. So you can see these are many different titles, and there may even be many more, but depending upon your location of your work, the title may change. So let's look at some of these locations. Your job location might be a community-based organization. It may be within a local health department or hospital or clinic. Maybe it's within a health insurance company or a nursing home or a senior center. It could be within a primary care provider's practice or within a specialty practice. So you can see there's a lot of different locations that you can use your role as a community health worker. So knowing all of this, what do we expect? What outcomes do we expect for our services? These outcomes are very important. Enhance communication and understanding between community organizations, social service systems, and healthcare providers. Another outcome is to increase access to and appropriate use of healthcare services. Many people, unfortunately, don't have access. We work with them to provide that. Raise health-related knowledge and healthcare screenings. And we find another outcome is improved adherence to health recommendations. Another outcome of CHW's work is to promote self-care practices and healthy lifestyles behaviors. We can tell a person what to do, but it doesn't work. Changes must come from within them to make lifestyle changes and to promote better self-management of themselves. And another outcome is realizing overall cost savings within the healthcare community. So we've talked about what we do, who does it, what are they called, where can they do it? So now I want you to hear from Ruth. So Ruth, would you introduce yourself and you will be hearing from Ruth some of the challenges of being a community health worker.
Thanks, Ginny. I'm Ruth Clark, as Ginny has mentioned. I've had the privilege of being on the team that's developed the curriculum for the CHW program, as well as I'm one of the educators. And as Ginny mentioned, we're both nurses, and that over 100 years of nursing, she usually tells us that it's because we went to nursing school right out of preschool. I sometimes say right out of the cradle. So there are always challenges when we work with people, and there are also wonderful opportunities, and you get a lot of positive working with individuals. With the community health worker work that you'll be doing, some of those challenges come because you're trying to help people on some of their worst days that they are having, or maybe the challenges that you're trying to find the right resource for them, and that's a struggle. But it's going to be something that's very worthwhile as you work with people. So just a couple other things that we think about for challenges. One is that many of the health plans currently don't pay for community health worker services. That's improving. However, we still see many of them that don't pay specifically for the work that you do. In the past, community health workers haven't always been recognized as legitimate providers or members of the healthcare team. Again, we see that improving, especially in a primary care practice, in community organizations that work with people who need resources. So getting to be a lot better there. And in fact, we're seeing more and more where there is a need for community health workers expressed in various organizations. And standards and requirements aren't the same across organizations and states. There isn't a specific set of requirements or standards that may be different in Michigan than it is in California, than it is in Texas or Iowa, or wherever you are. One of the things that has improved as far as reimbursement is that as of January 1st, Michigan approved for Medicaid fee-for-service, Medicaid health plans, and integrated care organizations that they will pay for specific community health worker services performed by approved CHWs. Now, there are some requirements around that. However, that's a big step because services were formally allowed under the Affordable Care Act way back in 2010. So this tells you how long it's really taken to get this to happen. It allowed for each state to create their own policies, and so Michigan has done that effective January 1st. Blue Cross and other payers reimburse specific services billed by community health workers who complete the approved training, which is the PTI program is one of those, and that provides services in patient-centered medical home practices. So there is an 7-8-hour training that is also required for Blue Cross called Introduction to Team-Based Care. And again, that's offered through PTI. Grant funding may provide some level of reimbursement depending on the organization in which you work. As I mentioned that there isn't standardization, a group formerly called the Community Health Worker Core Consensus Project, or C3 for short, has been renamed the National C3 Council. They have developed core competencies that many states have adopted. They came into being in order to be able to define the comprehensive roles, the skills, and the qualities of a CHW. What is it that you do? What skills do you actually need? And as Ginny talked about earlier, some of those qualities that you need as a community health worker. It formed a national consensus. Now, again, that isn't a standardized requirement across the states, but it did have different organizations throughout the country that came together and formed this consensus on some of the competencies that we'll be looking at. It provides some guidance for improving the practice and policies for community health workers. So they regularly look at what are those policies that need to be put into place? Are there changes in practice? Are there some educational areas? Do the core competencies meet everything that's needed? And it's intended to expand the cohesion in the field and help everyone to understand better the full potential of a community health worker. Now, they did identify 11 core competencies, and PTI's program does meet each of these as part of our approval for MDHHS to be able to provide this training. We had to meet all of these core competencies, and for each, underneath were a number of sub-skills, so very much more than is even shown here. So we look at communication skills. Our program has 2 full sessions on communication skills. It includes some things on interpersonal and relationship building, things such as conflict resolution. What is communication? What are the pieces of communication? Service coordination and navigating skills occurs throughout the program. That's a large part of what you'll do as a community health worker, is to coordinate those services so that individuals are able to receive the help that they need in their social determinants of health needs. Capacity building, both professional capacity building for the CHW and the community capacity, however you define that community. Advocacy skills. Here you'll help the CHW, or the CHW will be able to look at, can I advocate on behalf of my community? Can I help my patients or clients learn how to advocate for themselves? Because that's really important. Education and facilitation skills. You may lead groups. You may facilitate educational sessions. You'll learn a lot in this program that you may want to share with your clients and patients in a little bit more formal setting for education. So you learn, what is an objective? How do I set an objective? How do I lead a group? And what kinds of things might keep them engaged? Individual and community assessment skills is another area. So what can I learn about this person? What do I need to know about the community? Outreach. A lot of what you'll be doing is outreach to try to get the services that individuals need. You may also be outreaching to people, if you're in a primary care office, for example, outreaching to patients to conduct social determinants of health screening, to find out more about their needs and to connect them to those resources. Professional skills and conduct. You look at the Community Health Worker Code of Ethics, confidentiality, HIPAA. Evaluation and research skills. Here we look at, how do you know what the needs are in the community? How do you use data to find out the most pressing needs? And then how do you participate potentially in some research so that whatever is going on there, you can help identify and meet those needs? And then knowledge base includes a lot of different things. And there you learn about chronic conditions, behavioral health issues and substance use disorder, healthy lifestyles, prevention and screening, so much more. For PTI's program, we enhance many of these areas so that you have greater information and focus. We have 2 full days sessions that we have for behavioral health and substance use and disorders. And in there, we also talk about grief. We talk about adverse childhood experiences and how all of those impact. Chronic conditions. Again, we have 2 full sessions. We look at many of the common chronic conditions that you'll run into as a community health worker, because your people won't have only, and I say only, that those are very key, social determinants of health needs, but they most likely will also have one or more chronic physical conditions. They may have depression or anxiety or substance use issues. So it's very complex individuals that you'll be assisting. So we look at Alzheimer's and diabetes and congestive heart failure, chronic obstructive pulmonary disease, just many more conditions there. Cultural competency and cultural humility. And what do we mean by those things? And having that really be thread throughout the program so that we can look in each of those areas. How can we be more sensitive from a cultural perspective? Documentation. I'm a nurse. If it wasn't documented, it wasn't done. So it's very important that that documentation is there so that any team member can pick up the record and see what is going on. Learn more about health coaching with healthy lifestyles. Health equity and health disparities, again, is an area that is thread throughout the program. So early on, we talk about what health equity is, and then throughout, we talk about health disparities. Who is struggling most from a cultural standpoint, for example, for certain chronic conditions or behavioral health issues? We look at health literacy and how that ties. Health promotion and prevention, so screening and preventive measures, as well as healthy lifestyles. We spend 2 full days on motivational interviewing, which is a communication tool. How do I help to bring out for my patients or clients the things that they have within them that will help them make a positive behavioral change? We look at health insurance, all those acronyms that everybody runs into. What do they mean? And then again, social determinants of health are really weaved throughout that program into looking at what are the social determinants of health and what resources are available. Now, I mentioned that there are requirements to obtain reimbursement for the Medicaid community health worker services. They are listed here. You must be 18 years of age or older, have at least a high school diploma or a high school equivalency diploma or certification. You must meet the community health worker training program pathway, which you will meet with PTI's program, or for the initial 24 months. So that's 24 months is clock started ticking on January 1st of 2024. So during that first 24 months, which takes us through December 31st of 2025, you may qualify through the work experience pathway, but during that period of time it is expected that you would go through the training program pathway. You must have successfully completed a community health worker application with MDHHS as designated contractor and must be listed in good standing on the Michigan Medicaid CHW registry and complete provider enrollment requirements that are detailed in the provider enrollment section of the policy, the Michigan Medicaid policy bulletin that's referenced here. You'll also get much more information on that towards the end of our program. So the state of Michigan does recognize the 11 core competencies that were established by the National C3 Council as necessary for the CHW training education program. And again, PTI has been approved as meeting all of those. In addition, in order to maintain your certification through Michigan, you'll be required to maintain at least 6 hours of continuing education annually. And that it has recently been changed, so it may vary as we move along, so you'll just want to keep an eye on that. And then internship experience is an asset, and we do have that experience within our program. Any questions so far? I hope by now you're getting excited about the program. We're going to look at the program specifics now. What is it that you will be doing in this program? So we provide a certificate at the end of the program. There are 103 hours of instruction. Those are all virtual hours. We meet via Zoom. You'll have about 25 hours of homework total, and there's a weekly due date with that. We provide a course syllabus, and we'll have the due dates on that. And it may vary week to week. You may spend a little more time some weeks than other weeks on that, but on the average, about 25 hours of homework throughout the program. Also, 40 hours of internship if you're already practicing at a clinic or a practice or in another organization that is using your skills that they're hoping you'll enhance with the community health worker program. You could do the internship there, or we would help to find something if you aren't currently practicing. So 168 hours, it's a very robust program. The upcoming cohort is what we refer to as our accelerated cohort. What that means is that you'll be meeting twice a week on Mondays and Thursdays, and the 9 to 4 time frame is what is for each week, each session. You'll have 2 breaks and lunch during that day, but it's pretty packed. As you can see, we start out with community health worker basics, kind of a smorgasbord. You get a little bit of a touch of each area that we'll be focusing in more detail later. So it gives you a really good flavor for what's to come. Then, as I mentioned, 2 sessions on communication, then 2 on motivational interviewing, the ethical and legal concepts. We'll take a break during the spring break week and not have class that week. Then get into assessment and interventions. That includes things like home visits. Documentation. Spend 1 session on documentation of encounters. Professional capacity building, community capacity building. And then we'll start into some things more specifically health related. So public health and health literacy. Then we'll have 2 days where we don't have class because of Easter and Good Friday being within that section. And we know that a lot of folks do take some time off around there. We'll then have healthy lifestyles, screening and prevention, the 2 sessions on chronic conditions that I mentioned, then 2 on behavioral health and substance use disorder. Session 18 and session 19 are required. They are classes that you can't miss. So please plan ahead about that. Because in session 18, the afternoon of that day will be spent looking at how do we put all this together. We have all these separate sessions, but they weave together. And what does that look like? When we have a patient or a client in front of us, where do we start? How do we get that conversation going? And how do we help that person? And then in session 19, that's graduation. And there you'll have an opportunity to share some of your learning with your classmates as well as guests. So our program requirements somewhat similar to those for Michigan because you need to be able to practice once you leave the program. So you must be 18 years of age or older with the minimum of the GED or the high school diploma. We'd like you to come with some at least basic effective communication skills. We're spending 4 full sessions by the time we look at the 2 on communication and 2 on motivational interviewing. And then we practice those skills throughout. So you'll really upskill when it comes to your communication, but some basic skills are very helpful. Basic computer skills. We use Google Classroom. You'll be documenting your homework in there. You'll be taking post-tests each session to see where you stand with your learning. So having those basic skills will be very important, as well as you'll need to be able to access the Zoom. So having the computer, the internet capability with audio and video capabilities, because we will have discussion periods and we like to see your faces. Some of the things that will be included in that 168 hours of training, we have virtual sessions, as I mentioned, those are 9 to 4. We'll have case studies that we look at. We'll do role playing to get some practice on each of those skills. The homework due dates will be on the course syllabus and exactly what it is that we expect from that homework. The internship that I mentioned, 40 hours there, and you'll have a form that helps you be able to identify where you're meeting the requirements of that internship. And they tie very closely to those core competencies. There'll be a weekly evaluation of our session. We really like to know what you think, what you've learned, what could be better, what you really liked, because we're always looking to improve our program. And then, as I mentioned, the post-session tests will be weekly as well, with the due dates that will be available on the course syllabus. And it helps us to know, how did we do? Are you learning what we expected? And you'll need to pass those tests with 70% or greater, and you can retake them if you need to. You must be present and actively participate in all the sessions. We don't know what you're getting from the sessions unless you're actively participating, so that's really important. Miss no more than 2 sessions. So if a session is missed, you can make up the session by listening to the recording and turning in a 1-page summary of how those concepts may be applied. Complete and turn in all your homework assignments by the due date and time. That's listed again on the course syllabus. Complete all your post-session tests with a passing score of 70% or greater, and submit the completed internship practical log and assessment tool. That's where you're documenting all of those things that you're doing that show that you're practicing and that someone's overseeing what you're doing as far as mentoring you along the way. So why should you do this? Some of the benefits include professional recognition. CHWs are gaining that professional recognition. Opportunities for professional growth and opportunities for varying positions. Increase your personal and interpersonal skills, your self-efficacy. How do you use screening and assessment tools? What screening and assessment tools are there, and what can they share? You'll be introduced to the challenges that patients experience with their common chronic conditions. That's often within a primary care setting, but certainly no matter your setting, whether it's a community organization or a practice setting, you're going to see people with common chronic conditions. They're rampant within our communities. You'll gain familiarity with issues about behavioral health and substance use disorders. Navigating community resources is a huge piece. Through the program, you'll be able to identify what some of those community resources are, and your fellow classmates will also identify, which will expand your knowledge on what's available and how can I help my patient or client. You'll learn about organizing community health activities, things such as health fairs, and how to advocate for a person or a group. And then you'll identify resources to improve the well-being of the community. Again, that's in the community capacity building section. So we hope that you're interested in becoming part of our next cohort. To do that, complete the community health worker application. The link is here. Finish registration and payment. The cost of our program is $1,195. If your employer would like an invoice, you may contact Yang. And then the details of the program as you have just sat in on or are on session 0 on the recording. Feel free to share that recording with others that you think might want to participate, or we do have some live sessions as well where you're free to ask questions. So capacity is limited in our program, so we hope that you will sign up soon, and we look forward to seeing you in the next cohort.